Hello, my name's Sandy. I am one of the directors of the Stitch Hit, which is a health improvement team aimed at improving the lot for patients who come through our services with self-harm or suicidal ideation. And I'm just going to quickly spend a minute or so talking to you about the most recent intervention that we've been involved in, which was creating some resources to go onto Remedy for the GPs to use in the area, Bristol and surrounding area, for people with those issues. So I'll share the screen quickly and show you these pages. So this is one page. This is the self-harm page, and on that page, as you can see, I won't scroll down the whole page, but you can see that we've got an overview here for GPs. The idea was that it was sort of 10 top tips, you know, really quick stuff that's easy to access and has a lot of information and links to things that are needed. So an overview of self-harm, questions that you might ask, some suggestions there, red flags, things to look out for, some resources for self-management, a link to our local service user-led service self-injury support, something about medically unexplained symptoms. There's lots of people with trauma come through with symptoms that look like physiological illnesses, but are often unexplained and don't have the same results as those who have got those conditions. And then various resources. There's also a page here for those with suicidal thoughts, which we advise to read in conjunction with the page on self-harm. So whilst the two things are not necessarily linked, some people can self-harm without feeling suicidal. The fact is that self-harm is one of the best indicators of completed suicide, so we still tend to put them together on resources like this. So on here we also have the red flags again, but safety planning, resources for safety planning, some information about patients at crisis points, pointing towards counselling services, something called the Hope Project, which is an excellent project available in the community, and other sources of help. To finish, I'll just finish with this here. So we have some input from the service user perspective. We really wanted to have the service user voice as part of this, and we've involved people in the development of this page so that they've had a say in what it looks like. But I wanted to read to you a poem from a person who has self-harmed. Just stop sharing screen. From this book, you can see it. I don't know if you can see it. Oh, it's back to front, isn't it? It's called Who Am I by Emma Jane Stedden. And I thought I'd finish by reading you one of these poems, which is one of the two poems that's on Remedy for GPs to look at. We wanted them on there because whilst it's important to have all this information, it's also really important to give them something that helps to get in touch with the actual experience and what it's like for people who self-harm. There's a kind of human element that isn't quite so easy to get across in bullet point lists, and so on. So this is called One Little Moment. A moment of sharpness, hatred, and pain is an hour of joy, 30 minutes of lust, 20 minutes of relief, 10 minutes of relaxation, 5 minutes of worry, 2 minutes of guilt, and a lifetime of scars. I want to scream, I want to shout, I want to let this misery out. I want to cry, I want to feel, but most of all, I want to heal. Thank you.